Good morning. Thank you for joining me for this morning's update. Joining me on our call today is Sheriff Mike Williams, Fire Chief Keith Powers, Emergency Operations Center Director Steve Woodard, and UF Health Jacksonville CEO Dr. Leon Haley. As of this morning, the Florida Department of Health is reporting a total of 3,419 COVID-19 cases in Duval County, 325 hospitalizations, 62 deaths, and a cumulative positive testing percentage over time of 4%. Before we move on for the rest of the briefing, I'd like to ask Dr. Haley, CEO of UF Health Jacksonville, to address the media for a few minutes and talk about the local COVID-19 response. Dr. Haley, thanks for joining us.
No problem. Thank you, Mr. Mayor, for inviting me today. So as Mr. Mayor described, we obviously still are battling the COVID pandemic. One of the things that we've been emphasizing with our team is let's not focus on what a second wave may or may not look like. We are clearly still in the first wave of this event, and we're still obviously trying to make sure that we're taking all the appropriate measures as an organization and communicating that as a community. In our organization, I can tell you that our numbers have doubled over the last week in terms of our actual admissions, and we probably have about 30 patients that are currently under investigation, which means that we suspect they may or may not have it, but we've been testing. We do have 7 patients in our ICU right now, which is a significant increase over last week. The other thing that we have seen is a demographic change. So the patient population does tend to be a little bit younger than we were seeing in the early part of the phases. As an organization, we continue to stress testing of our patients, particularly those who are coming to the hospital for elective procedures, ambulatory operations, some clinic visits. We do have locations, multiple throughout the organization where they can be tested, and we want to continue to emphasize that. We do have plenty of PPE, so in terms of the ability to make sure that we're protecting the staff in terms of masks and gloves, those things are still in place. Because we obviously are still battling, we have limited visitation, so we still are limiting to just 1 visitor per patient per day to make sure that we can continue to limit the exposure for folks. And we continue to communicate with our staff on a regular basis. What we communicate with Mr. Mayor is the importance of still doing masking and distancing in public. We think that those are still critical. We still think that testing is critical, certainly for patients that are asymptomatic. Certainly for patients that are symptomatic. So we will continue to respond to it, and we'll continue to make sure we can adjust to it. I think it's, there were obviously some earlier assumptions that because it would be summertime, things would just go away. We have not seen that. So I would just try to encourage that people continue to mask and distance where appropriate.
Thank you, Dr. Haley. And again, I want to thank you for the relationship and the communication that we have had and continue to have as we navigate COVID-19. I'm going to go ahead and provide the briefing, and then everybody that's on the call will all be available for questions at the conclusion. Last week, I talked about a partnership with City Council members Ron Salem and Michael Boylan to provide relief to businesses and individuals in Jacksonville. Last night, City Council passed an additional $3 million to the Small Business Grant Relief Program, which provides a one-time payment of $2,000 to each of the qualified businesses. That's 1,500 new businesses that will receive these relief dollars. We will have more details in the coming days on how new businesses can apply for this relief. In addition, Council approved $2 million in partnership with JEA to assist customers that are at risk for disconnections. JEA will be reaching out to qualified customers. I'm grateful to City Council for their partnership on this effort, and to members Salem and Boylan for their leadership. Thank both of you. I want to remind everybody that we are still in phase 2 of the governor's safe, smart, step-by-step reopening plan, and numerous restrictions remain in effect for restaurants, bars, retail, and other locations. Restaurants, bars, and pubs can be opened with 50% capacity indoors and unlimited seating outdoors with appropriate social distancing, 6 feet. Entertainment venues such as movie theaters, bowling alleys, concert houses, auditoriums, playhouses, and arcades can operate at 50% capacity with appropriate social distancing and sanitation. Retail stores can operate at 100% capacity with continued social distancing and sanitation protocols. That's the same for gyms and fitness centers. Effective immediately, City code enforcement will be monitoring businesses throughout Duval County to ensure they are following these state-ordered guidelines. We've created a task force that will identify those in violation and report them to the Florida Department of Business and Professional Regulation. I spoke with Secretary Beshears about this process, and he advised that non-compliance of the state's reopening guidelines of 50% capacity indoors could result in a business having a business's alcohol or food license revoked. Look, we're not looking to create headaches for businesses doing the right thing. But as the governor said yesterday, if it's Dance Party USA and people are hanging from the rafters, we're going to have to take action. Again, our task force will work mainly in the evenings and in the coming days to monitor these situations. I'm continuing to remind folks that personal responsibility plays a major role in our united efforts to combat this virus. We need every one of us, every single one of us, to take personal responsibility and make wise choices as we continue to work our way through this. Please wear masks in public spaces, in spaces where you can't practice social distancing. Frequently wash and sanitize your hands. Continue to practice social distancing whenever possible. On the testing front, the state notified us early this morning that Lot J COVID-19 testing facility is closed for the day because of severe wind damage from yesterday's storms. The tents are bent and unstable. Weeks ago, we began a process to move all outdoor sites to indoor locations to protect them from the weather. We've identified an alternate indoor site for this testing location where weather will not be a factor. We're finalizing this plan as quickly as possible, and we'll keep you posted on that progress. If you need to be tested for COVID-19 today, the Legends Center is open, and there are multiple private locations open as well. You can go to covid.net/COVID-19 testing for a full listing of locations. Again, there are multiple options. I'm grateful for Dr. Moreland on my team for his leadership in during our testing efforts. You'll recall last week I asked Dr. Moreland to oversee coordination of our COVID-19 testing operations. We've seen a significant increase in the numbers of citizens being tested, thanks in large part to his efforts. My team and I have received a lot of comments about hosting the RNC in Jacksonville amidst COVID-19. Remind people we are still 2 months out from that event. And as I have said all along, we'll take a detailed look at where we are, where we stand in the next few weeks, and decide what the proper protocols are to make sure people are safe. But in the meantime, right now, we need to focus on what's happening in our city and what we can control. To be clear, don't be in a crowded bar or at a crowded event, not wearing a mask and not practicing social distancing, and then complain about events that are weeks and months out. Let's do what we can today and make the right decisions to keep people safe. And we'll continue to monitor the situation as we look at the weeks ahead to make sure we're practicing the proper safety protocols. Before we close, I want to once again thank the healthcare workers, first responders, grocery store employees, and all essential workers who have kept our city running these past few months. You've made us all proud. With that, we'll take questions, and we'll start with Jim, News for Jax.
Mayor, can you hear me now?
I can.
Okay, Mayor, a couple of questions on that. You had mentioned that we shouldn't be looking ahead to the RNC, but we need to be looking at what's happening right now. Well, a lot of people say what's happening right now is a good indication of what we can expect. We're seeing the numbers again today go up. We just heard hospitalizations at UF Health. We just heard that their numbers doubled this week. You haven't made a statement at this point, today, about maybe changing your mind regarding masks. We're hearing from bars and people that have tended bars at the beaches and now in Riverside where they've become sick as a result of this. And many people are just saying this all happened too soon. I don't know if you could address that and the numbers that we're seeing now, and if the sheriff is on the line, if anything has been done in the past to go to cite bars that have been done, and if the sheriff could also update us on what's happening at the jail now with the COVID cases there, if we're seeing more there. There are just a lot of questions, and we're seeing a lot more people become positive, and people are concerned about that. I guess that's a lot there. If you could answer that for us.
Sure. Thanks, Jim. I would say, as I said before, as we look at any event that are months or 2 months out, we'll assess the situation as we get close and make decisions based on best interests of public health. But what I can tell you is right now, you mentioned people complaining that they're going to packed bars where maybe they're over 50% and they're not wearing masks, and they're complaining that they've picked up the virus or that it's being spread. Well, they need to practice personal responsibility. And here's what we can do right now. Go into a bar packed with people without a mask on and talking about what could happen in August is not a right personal decision for personal responsibility. So in terms of code enforcement, as I said today, the governor said it yesterday, we are going to send our code enforcement in conjunction with state officials to monitor and check up on these restaurants and bars. If they are trying to comply and it's not out of control, we're going to work with them. But where it's flagrant, where it's dangerous, again, as the governor said, Dance Party USA, people packed in, hanging from rafters, we're going to take action, and they risk losing their license. So people need to behave and react responsibly. Yes, as Dr. Haley mentioned, I talked to all the hospitals in town regularly, and some have experienced an uptick in patients, and that's something that we will continue to monitor. We're not at a situation where the health systems are stressed or close to being stressed, but we don't take that for granted, and that's why I encourage wear masks, practice social distancing, behave responsibly. Sheriff, I think there was a question in there for you as well.
Yeah, there was. Thank you, Mayor. And so, Jim, I think the Mayor answered the question about enforcement. That will be handled, obviously, as he said, through regulatory agencies. And as far as the jail goes, as the Undersheriff briefed everybody, I guess a few days ago, we had our first positive cases in the jail last week. Through a series of events and working with the Department of Health, we decided to test every inmate in the jail. So we're about 600 tests in at this point, and we still only have 20 positive. So that's about a 3.4% positive rate for the jail. And obviously we continue to do that testing today. These numbers were as of the end of at close of business yesterday. So we're in the process of doing that today. That number is about, we've gotten really about 22% of our population tested. It's going pretty quickly. So we should, within the next week and a half, at least have everybody gotten one test and be able to have isolated what we feel was a minor outbreak right now in the jail. In terms of the health of the inmates that have tested positive, you have some with minor symptoms. Most of them are asymptomatic at this point. So,
thank you, Sheriff. Bridget with Action News.
Hi, good afternoon. Just a couple questions for you, Mayor, and a couple for the Sheriff as well. You talked about a task force. Can you expand on that? How many people will be a part of that? And you say that this will be monitored mainly in the evenings. Do you have specific hours? I know in Orange County, they're doing 5 p.m. to 1 a.m. And then does the city happen to have a number of complaints of businesses for not complying that you might have compiled over the course of since the reopening? And an RNC question, we're hearing few details have been worked out. Is the city being kept in the loop about planning? And then for the Sheriff, do you have numbers as far as citywide crime numbers? Are they up? Are they down? I don't know if you'll have a breakdown right in front of you, but do you have just the number, the percentage of crime citywide? Is it up or down?
Yeah, thank you. I would say as it relates, look, we have a code enforcement division that before the pandemic on any given day enforces, fire code, capacity code, et cetera, codes that are on the books. What we've done is taken existing code enforcement employees, I don't have the number off the top of my head, but enough to cover the territory, and they will be out at any given point in time checking restaurants and bars. So people just need to comply with the 50% occupancy rules that are in place. As it relates to the RNC planning, I don't have any details at this point. No one has shared with me security parameters or any of that. When we have information that we can share that's been made available to me, we will. I can tell you that the host committee, which I'm a part of, which is a nonprofit, non-political organization that's about economic development. The focus of that organization right now is raising private dollars for the event. With that, Sheriff, I think there was a question for you as well.
Yeah, thank you, Mayor. So, Bridget, the short answer is we're sitting now at about 9% reduction in crime overall. So you've got a slight increase in violent crime between 4 and 5%, if I'm remembering correctly. And we're down almost 12 or 13% in property crime. So overall, that equates to just about a 9% overall reduction as we stand here today.
Troy with First Coast News. Can you unmute your Zoom, please, Troy?
Sorry about that. Can you hear me now?
Right. I can.
Okay, so my question is about the code enforcement, and again, how often will the officers be out there? And the second question is that the state guidelines, some say that they recommend businesses require staff to wear face masks and do things like that, but do businesses need to be more strict on their guidelines? Is that what your message is to restaurants? Because if they're doing all they can, but people are still going out and packing the bars, then that doesn't obviously do anything positive.
Yeah, look, to answer the code enforcement piece, effective, they're out. I mean, you could right now, one could walk into your restaurant or your bar and check your occupancies. What they'll be looking for is what it falls under the governor's executive order, and that is capacity. So it is the responsibility of the bar owner to make sure that they're not over the 50% capacity and people aren't in there shoulder to shoulder. And I would encourage, I strongly encourage people to wear masks when they're in these retail stores, grocery stores, convenience stores, places where they can't practice social distancing. Businesses, I would encourage, look, if a business chooses to say you have to have a mask on to come in, they're a private business and they can do that, and they can choose not to serve somebody for that reason. With that, Hannah with WOKV.
Hi, Mayor. I just had two questions. One, do you plan on creating more testing sites specifically at the beaches where it seems like most of these cases are coming from? And then also, has there been any talks about a timeline for the RNC, especially with the host committee, as it's 61 days away?
I'll answer the second question first. I think I said before, the focus of the host committee right now is fundraising private dollars. So that's what people are doing. They are calling people and asking for financial contributions, and those dollars will be used to put on the events surrounding the convention. And that is a nonprofit organization that's doing that. As we are actively working on getting testing availability out at the beaches area. That is something that's in process now that we hope to have up and running soon. But I would say we have worked hard to expand testing and continue to expand testing and encourage people to go out and get tested. I would remind you that when all of this started, when we started standing up tests early in this pandemic, the only people that we could test because of availability were those that had symptoms and those that fell into risk categories. We've now expanded sites to where anybody can go in and get a test. Therefore, more people are getting tested. I would also remind you, as we talk about this virus in our healthcare systems, it was stated very clearly on the front end of all of this that the goal was to protect our healthcare systems so they were not overloaded with COVID-19 patients and then unable to serve those patients, take care of those patients, and then be unable to treat patients with other diseases and other issues that would require hospitalization. And so we did that. Now that we are in phase 2 of reopening, we encourage these behaviors. We have these capacity limitations in place to protect people while the virus is with us, to continue to protect our hospitals so they can handle COVID-19 patients, but they can also handle heart patients, cancer patients. I mean, the list goes on of people that need access to health care, and it's about protecting our hospital systems. Always a stated goal the goal that we remain focused on. Chris with the Florida Times Union.
Hey, Lenny, can you or someone in your administration tell me or tell our viewers how many people are in hospitals right now who have been confirmed of having COVID-19? How many patients who are hospitalized right now are suspected of having it? And how many total ICU patients have COVID-19? And if you can't provide that information, can you just explain to people watching why they can't have information or access to information that Americans in other cities do?
Well, I don't have, off the top of my head, I don't have the raw numbers of hospitalizations. What I can tell you is in phone calls that I made this morning, while we have experienced an uptick in certain hospitals over the last few days, there hasn't been, in the last 24 hours, there hasn't been a significant increase. ICUs are not full of COVID-19 patients at any of the hospital systems at this moment in time. In terms of releasing daily numbers about COVID-19 patients, that's not my data. That is the data that belongs to the healthcare systems. And they will release what they believe is appropriate at that time. But what I can tell you, and I will continue to share with the public, is we're monitoring those hospitals and healthcare systems. They are not overloaded. They are not stressed with COVID-19 patients, even though there has been an uptick. And as long as this virus is with us, understand, you're going to see moments in time where you see increase in positives. You're going to see, I've talked to hospital leadership where we've had a day where you have a spike that goes up 3 or 4 or 5 or 6 patients, and then a day later it's down 8 or 9. So it's fluid, but at this moment in time, there is not a stress or an overload on our systems. Ellen with the Jacksonville Business Journal.
Good afternoon, Mayor. 2 quick questions for you. You've stressed the need for personal responsibility in terms of continuing to curb the spread of the virus. I'm just curious how far you expect that responsibility to extend. Is there a point at which you would consider reinstating regulations and other mandates, like wearing masks or, closing down the bars that are getting so crowded? And then second question for you, I realize that the RNC is still a few months out, but I'm curious if you can give us an update in terms of where the host committee is in terms of planning. Are you looking for vendors or other businesses to partner with?
I'll answer the last question first. The host committee right now is simply focused on fundraising. RNC staff handles the organization of all the events and whatnot. The host committee is not planning and executing events. They're focused right now on fundraising. As it relates to personal responsibility, so we have to protect our healthcare systems and our hospitals, which is part of flattening the curve. The shutdown, the safer-at-home orders were necessary at the time, but they were incredibly painful for a lot of people economically and with health issues. We've got Dr. Haley's on the call right now. I can tell you that there were a number of people that weren't going to the hospitals during the safer-at-home orders because they were afraid to, and they had real issues. So the goal is understanding the virus is with us, understanding it spreads person to person. We want people to be able to go to work. We want people to be able to live their lives. They just have to behave responsibly, hence the capacity requirements that are in place put forth by our governor. As it relates to masks, I encourage it. The governor has encouraged it. But I've heard other cities around the state that have said they've mandated it and they've been asked, how are you going to enforce it? And they've said, we can't, therefore we won't. So we're not going to put additional mandates on people that can't be enforced. That will also then encourage people. I've heard stories of people being in stores where someone has a mask on, someone doesn't, and they start arguing with each other. That's not appropriate either. If you see someone in a store that doesn't have a mask on and you feel uncomfortable, I wouldn't get within 6 feet of them. That's how we behave responsibly. So that's the last question. I want to thank everybody for joining us today, and we'll continue to keep you updated and informed.